okay right now? Okay. All right. All right. Looks like we are live right now in Facebook. Uh, Good evening and greetings to everyone who are live right now with us, who have joined us for the Facebook live session on primitive reflexes and autism. And greetings to each one of them who are going to log in later and watch this video in the offline mode. First of all, I have to say thank you to Autism Connect to invite me to talk about a very untouched, unexplored, however, very significant topic, which is about primitive reflexes and its role or its influence on individuals with autism spectrum disorder. So, a big thank you to Autism Connect for this hosting this live session today. Just to give you a quick introduction about myself, I am Harish Badiger, and I'm a physical therapist by profession. And I have been practicing in the field of pediatric rehabilitation since last 15 years, providing therapeutic services for their betterment. Uh, Currently, I am associated as a physical therapy consultant at Vishesh Child Development Center in Mumbai. And as you all know, today's topic is about primitive reflexes and autism. So, in my last 15 years of clinical practice, I feel very fortunate that it's been a huge, great learning curve for myself in this field of pediatric rehabilitation. And honestly, I have to thank all the mentors, expertise, parents, and professionals who came up with their very unique concepts and methods, where I got a chance to expose to these various methodologies and concepts. Just to name a few of them, say general movement assessment, Feldenkrais method, Anat-Baniel method, sensory enrichment therapy, primitive reflex integration, instrument assisted soft tissue mobilization, sensory integration, neurodevelopmental techniques, aquatic therapy, and the list just goes on and on. And honestly, the exposure to these techniques has helped me to sharpen my clinical skills. And I have realized that a combination of these methods can only boost the outcomes in your child. But last 10 to 12 years, what has taken a deep attention is the topic of primitive reflexes, which I personally feel and I have experienced. And there is a lot of research that is coming up in last 7 to 10 years, which says that this can be a very powerful tool of assessment and intervention in your clinical practice. And that is what we are going to talk here today in our 20-25 minutes. Whatever I have, I'm going to give you an overview about importance of these primitive reflexes, especially in cases of autism spectrum disorders. Now, I'm not going to talk much about autism definition, causes, and the clinical science, etc., because a huge volume of information is already available online. So I will straight away rather jump to the topic of reflexes, primitive reflexes, and give you an overview about that. Now, before we go, let us try to understand what is a reflex. Now, if we go by a simple definition of what is a reflex is a response to a stimuli which is automatic, does not involve your conscious thought, okay? And it can trigger a motor response or it can trigger your glands to secrete certain hormones. So it could be a somatic response or it could be a visceral response. Now, I will repeat again. It is a response to a stimuli which is automatic, does not involve your conscious thought. Okay. So it's a very basic prototype movement. Now, we all should know, or I believe we all understand, for any complex structure or complex movements to occur, there should be a reference point. See, in our life, we do so many things in day to day activities, but there is always a reference point where we come back to. Now, these reference point, what we call the primitive reflexes, These act as a building block of human brain and development and our behavior. Now, I want to explain how. Now, let's take an example. I take you to a room, okay, and there is an object kept, and I ask you to touch it. On day one, you would just touch the object and just keep it back, okay? It might attract you, it might not attract you, you might explore, and you might just keep it back. It could be, assume it could be a pan or any metallic object. Now, on day two, if we go again, if you touch the object again, it might not fascinate you anymore. Okay. But on day three, suppose if you go and if you hold and that object is extremely hot, you would just drop it immediately. It would trigger a withdrawal response in you. Okay. It would just trigger a flexor withdrawal response. You would just, immediately, even before you think what to do, a reflex would be triggered and the object would be dropped off just to protect your hand from danger of burning. Now, this has caused not only a motor response, a withdrawal response that you would drop the object because it was an unpleasant stimuli. Your brain could sense that this is something dangerous. It might lead to some form of injury to your hand. And to protect that, it triggered a quick, very quick response where you would drop the object. Now, this has stimulated a very unpleasant experience related to this very specific object. Now, if you go second day, if you go again to that object, this time you would be very careful about how you are going to handle that object. Okay. Now it has triggered your thinking process, whether you should touch, whether you should not touch. And if you want to interact or manipulate that object, you will be very precisely going to touch and try to feel, the temperature and see if it is safe enough to hold it. Okay. Now this is how it would work. Now, a simple reflex has made you more aware about this specific object. And as you try to interact, I mean, if you manipulate this object on day-to-day basis, it would always try to go back to your past sensory experience of that unpleasant stimuli, and you would always be careful about it. Okay. Now, this is how the reflex actually influences our learning, our thinking process. And that is why we call it as a building block of nervous system. Now, let's take an example. In our day-to-day life, suppose if you're walking in a road, you go to different places. We are not bothered about the dogs. Let's take an example. You're not bothered about the dogs in your day-to-day life. I mean, even we do not even pay attention, what is going around us, what is moving through us, moving across us. Now, one fine day, unfortunately, you step over a dog and the dog happens to bite you. And that triggers a reflex called as fear paralysis reflex, where you are extremely in pain. You freeze for a second, you don't know what to do. And that has suddenly changed your sensory experiences associated with a animal called as dog. Now, next time when you step out, you will be extremely alert about dogs moving around your environment. You will not want to move. Suppose if you want to cross a lane, you will your brain will again go back to your past sensory experience, and it will try to think whether I should go, whether I should not go, whether I should cautiously go, should I take an alternate route, should I wait for the dog to pass. So you see, a simple reflex that got triggered because of an unpleasant stimuli has not only helped you to have a deeper understanding about how to interact with the environment, but it has also triggered a strong emotional reaction, right? Now, even in our day-to-day life, let's take an example number three. In your day-to-day life, suppose if you are listening to this live session and suddenly there is a third sound, there is a loud sound, and suddenly you startle and you want to know, okay, what was that? It took your attention. Correct. So primitive reflexes, as I said, they would influence very strongly in a way how we interact with in our day-to-day life, and that is how we want to know in this session what happens if the primitive reflexes are retained. Now, the primitive reflexes are innate, they're genetic, they are pre-programmed, and they help us in survival and development. Earlier, some resources used to mention that these primitive reflexes do not have much of clinical importance as they are controlled by the lower centers of the brain and they eventually fade out. But now, since last 10 to 15 years, 20 years, a lot of research has taken place, a lot of study has done, a lot of material now published. They say that primitive reflexes are very, very important in the nervous system. I mean, in the development of nervous system, and they can actually influence in a huge, huge way, especially leading to neurodevelopmental disorders. Now, when we talk about primitive reflexes, these primitive reflexes emerge right from the fetal stage. Their primary role is survival and development, as I have mentioned. They also help in birthing process, and they also help once the baby is born to achieve milestones in a very broader view. Motor milestones, cognitive milestones, social milestones, speech milestones. Uh, so what happens when the baby is, I mean, when the during the fetal stage? Now, a lot of research also says that a lot of learning happens in the fetal stage. Now, we need to understand there are some reflexes which help the fetal body to move in the womb, right? Now, when we talk about the mother's womb, the environment is completely different. uh, the fetal body is floating in the uterine fluid, and it's dark, it's warm, everything is dampened, and we know that movement is essential for the brain to grow. So the fetal body has to move to allow stronger sensory motor neuronal connections to take place. However, at this stage, the human brain is dependent on the experiences of the mother during her pregnancy stage, how her pregnancy is going to influence the fetal brain. So, whatever the mother is going to influence in the pregnancy stage, it is going to impact the fetal brain as well. Now, suppose if the mother listens to a song which makes her happy, it will trigger dopamine, which is a happy hormone in her, which will be sensed by the fetal brain, and it will activate certain reflexes where the baby will start moving in a sense of joy, right? And if this continues to happen, if there are a set of songs or there is a set of music pattern the mother likes and which makes her happy, once the baby is born, the baby will also be inclined towards such type of music. Okay. Now, one of the reflex which is important to perceive the auditory sense is the ATNR reflex, asymmetric tonic neck reflex, which involves horizontal movement of your head. Now, when the mother listens to any music that makes her happy, it will be perceived by the fetal brain and through the ATNR reflex. And as the baby tries to trace the source of sound, it triggers motor response, that is the extension on one side of the body and flexion on the opposite side of the body. And this movement helps in alternate movement or flexion extension movement that also allows the baby to move, right? So that is one example how one of the primitive reflex would help to perceive sound. Now, one of the reflex which we want to highlight about is suppose the mother is in a state of a lot of anxiety or stress during the pregnancy. Her cortisol level would be very high, and this emotional stress would be perceived by something called as fear paralysis reflex. I mean, it would be perceived by the fetal brain, and it would trigger a reflex called as fear paralysis reflex, which will dampen the fetal movements to conserve the energy so that this energy can be taken up by the mother to cope up the stress. And if the parent, I mean, if the mother continues to be in a state of stress for a longer period of time, this can actually continue to dampen the fetal movements. That means reduce fetal movements, which can weaken the sensory motor neuronal connections in the brain and not allow the brain to develop fully. So you see how the reflexes continue, I mean, even in the fetal stage, help in the process of learning. and any drastic internal or external source that is going to cause an undue stress during the pregnancy, directly or indirectly to the fetal brain, is going to influence heavily, and it is going to trigger a lot of unwanted reflexes to emerge, to get activated, which will dampen your movements. Okay, the primitive reflexes also play important role in birthing process. Now, during labor contractions, ATNR reflex, symmetrical tonic neck reflex, spinal galant reflex, leg cross flexion extension reflex, these are all automatic movement patterns which help the baby to pass through the birthing canal and come out. And we all know the fetal body is in a flexed position and the environment is completely different in the womb. And once the baby is out in an external environment, suddenly the Moro's reflex is triggered as the brain perceives a sudden change of environment from a safety environment. Now everything is so overwhelming, it triggers a sense of, it triggers the Moro's reflex where the baby suddenly goes in a state of extension and the breathing mechanism sets in. So, what I want to mention here is every reflex has its own role, it has its own timeline. They are all genetically coded. You do not need any previous learning. It is all, pre programmed, and they are all going to influence your emotions and your movement patterns and your learning. And once the baby is born out, we all know the cortical brain is still not developed at that stage. And it heavily relies on the lower brain and the spinal cord to interact with the environment in day-to-day basis. Now, one of the example I would like to mention here is a simple grasp reflex. I'm sure you must have seen babies, they usually keep their hand fisted, right? Now, if you stimulate the tactile part of the base of the palm of the baby would just curl and form a grip and hold your finger relatively firmly. Now, we all know that grasp reflex is very important because it helps in motor patterns to develop, especially hand functions. Okay. Now, we also need to understand that the grasp reflex is not just only about you know hand functions. It has a lot to do. Just an example to brief about grasp reflex, there are many more. Now let's take an example here. If I place the pen here, you would not get an idea about the dimensions of the pen. Let's assume that your eyes are closed and I keep the pen on the palm. You would not understand what it is. But unless you grasp it tightly, then you would have a better understanding what the object looks like or what are the dimensions of the object. And you start differentiating your environment in day-to-day basis, right? So the more we try to stimulate the baby's palm by giving different textures, different objects, different toys, okay, it starts to perceive the object. It gives them a sense of understanding. They try to differentiate these objects, and as the baby continues to grow, these automatic patterns are slowly differentiated into more precise, purposeful movements that allows the baby to manipulate over a period of time. Okay, so if we go through the actual timeline, once the baby is born, the movements of the baby are very random, they're very automatic, they are not predefined, they heavily rely on their reflexes to interact with their environment, right? Now, as I said, if you hold an object at the palm, the baby would unintentionally, without giving a conscious thought, would hold the object. But this becomes a foundation for the motor patterns to develop. This becomes a foundation for a sense of understanding what needs to be done with this object. And that is possible when your sensory and motor pathway are functional and not dysfunctional, right? Now, we all know when we get angry, we also try to hold it tightly. We make a strong grip to control our anger, right? So, grasp reflex is also very important for emotional regulation. Now, in our day to day life, we hold something tightly. Whenever there is a dispute, we hold something tightly and we want to show that sense of authority that, okay, this thing belongs to me, this is mine. So grasp reflex also gives you a sense of authority. It gives you a sense of understanding what belongs to you. It gives you a sense of understanding that this is mine. I should not be sharing, right? Apart from your finer skills, gross motor skills, calculations, you are able to differentiate your fingers, you are able to calculate, you are able to count, you are able to precisely work with your finer motor skills or fine motor skills, right? And as I said, it helps you in differentiation of objects around you. It helps you to interact. It helps you to think. It helps you to imagine what needs to be done. And that becomes a foundation of your day-to-day learning. So grasp reflex is not only about, your motor skills, but it has a lot to do with your cognitive development, a lot of your social understanding. Now you must have seen toddlers, they hold as they walk around, as they learn to walk around, they always hold the little finger or the finger of their parents. Now that gives a sense of security as well. So grasp reflex is also very important, which gives you a sense of security. It helps you to bond with someone. When you hold someone, if like suppose if your friend is in a state of stress, and if you just hold them firmly, you just hold them firmly, it gives them a sense of assurance, right? So grasping is just not about motor skills. It gives them a sense of assurance. It gives you a sense of authority. Now, same way, let's talk about STNR reflex, symmetrical tonic neck reflex. Now, you must have seen uh, children have visual depth perception issues. They are not able to mimic. They are not able to judge, their surroundings. They will be very clumsy. They will be accident prone. They will have difficulty in obstacle crossing. They will have difficulty to copy something from very far. Or if you throw a ball, they will have difficulty to perceive the ball coming at certain speed towards them. Now, what is STNR? STNR is basically linked to your vertical movement of the head. Now, if you look down, it will block your periphery. Your whole attention will be central. I mean, it will trigger a central response. Your vision will be very focused down. It will block your peripheral vision. And if you look up, it will give you a very broader picture. Your peripheral vision will increase, right? So it helps in understanding the depth perception. So if STNR is retained in children, it will give rise to visual problems, eye-hand coordination problems. And if grasp reflex is retained in children, it will have difficulty, they will have cognitive delay, they will have difficulty to interact with their environment, they will have difficulty to manipulate objects, they will have difficulty to understand what needs to be done, with every object. They will not have a sense of understanding. Now, let's take an example, the Moro's reflex and fear paralysis reflex. Now, the Moro's reflex and fear paralysis reflex are multisensory reflex which are deeply connected in your sensory system. Now, what does this do? It prepares you to react to a stimuli which you are not prepared for. Any sudden stimuli, if it comes to you and if you experience it, it might trigger a Moro's reflex or a fear paralysis reflex. So you go in a state of flight fright response, and you try to understand it makes you more alert. You try to understand what is going on. Okay. Now, as I said, if there is a sudden third sound, it would just make you alert. You would startle and you would want to know where that sound came from, right? Now imagine in our day-to-day life, we are able to filter out the environmental stimulation, the noise of the fan, people talking across, the honking, the traffic, the lighting around us, and so many things around us. That is so overwhelming. But our conscious brain is able to filter out everything, and we are able to focus only on what is required, right? Now, that is because our cortical brain is smart enough to filter out all the unwanted stimuli, and it helps us to focus. Now, if your Moro's reflex or fear paralysis reflex are retained, every stimuli you experience in your day-to-day life. Okay, now suppose if the child has auditory dysfunction, I mean, the pathways which help in auditory processing are dysfunctional. Now, every time they hear or experience an auditory stimuli, it will trigger a fear paralysis reflex in them. Okay, it will not allow the brain to condition those stimuli. it will always trigger that sense of anxiety, a sense of fear in them. And that is the reason they start blocking their ear. They get frightful or fearful about certain sound. Now, same way, if your visual pathways are dysfunctional, okay, and if you take the child to a bright lit area, or if there is a lot of visual stimulation, it will trigger again fear paralysis reflex, and they would not want to go to that area again. So, fear paralysis reflex and Moro's reflex can induce a lot of undue stress, anxiety in these children. Now, Babinski sign or Babinski reflex, just for an example, has to do with a lot of your feet movement, feet alignment, sensory motor pathways related to your feet. And if these pathways are dysfunctional and and the Babinski reflex does not integrate by age of 2, 2.5, or 3 at the maximum, this can lead to toe walking. And we all know that our sensory areas at the feet or the sole are very, very strong. You are able to differentiate your floor, you are able to differentiate your ground. It gives you a sense of balance, stability. You are able to move in a particular way, the way you want. So, if the Babinski reflex is written, many children will have sensory issues stepping on certain textures. They'll be clumsy, they will walk, they might have in towing, they might walk on their toes, right? Uh, Next example is the Babkin palmomental reflex. Now, if you stimulate in a baby around 3 to 4 months, if you stimulate the central part of your palm, the mouth of the baby would open. Now, this reflex prepares the baby for hand mouth association, right? So, if you give an object to the baby around 6 months, you must have seen a lot of babies. I mean, all the babies, they would just put the object in their mouth to explore. Now, Babkin palmomental reflex is a foundation for eating mechanism. I mean, for the brain to learn how to eat, hand mouth association. Okay. Now, if Babkin palmomental reflex is written, a lot of children with autism spectrum disorder will have mouthing. Everything and anything they hold, they will try to put it in their mouth. They will try to explore it with their mouth. So if your back-end palmomental pathways are dysfunctional, if they are retained, it would affect a lot of your oral structures. They will be a fussy eater. They might have difficulty to chew. They might have difficulty to suck, swallow. A lot of sensory issues around the oral areas, and it might affect their speech and articulation as well, right? Now, let's take an example about the spinal gland reflex. Now, spinal gland reflex basically means if you give a stimuli, a tactile stimuli to the paraspinal muscles, there would be a contraction of the paraspinal muscles on the same side. Now, if your pathways are dysfunctional and these primitive reflexes are retained in any child, they would be extremely fidgety, they would be extremely restless, they would have difficulty to sit or stand, for a longer period of time, and it would impact their attention. The child will be extremely, extremely restless. They would not want to sit at one place, they will be always on the go. Same way, tonic labyrinthine reflex, which is associated with your sense of balance and stability. If these reflexes are retained, the child will be having gravitational insecurity. They will not like to go on a height. They will avoid stair climbing, descending down the stairs or going up the stairs. They will not like swing. On the contrary, there are some children who would seek a lot of vestibular, you know, sensory inputs. So it depends whether what is their threshold, whether they have a high threshold or whether they have a low threshold. Now, one more reflex I want to highlight is something what is called as Pavlov orientation reflex or the Pavlov reflex. Now, this reflex basically means it triggers a sense of curiosity in us. Now, suppose if you're walking around and suddenly you see something new, something unique, it catches your attention. You become more curious to know about it. Now, let's take an example. You might be in your home, you come from work, you might be used to the same routine of coming, putting your bag, and going off for a shower or going to freshen up. Now imagine you come back on the next day and you see a new mobile phone that is kept on your table. It will catch your attention. It will trigger the Pavlov reflex, and it triggers a sense of curiosity in you. and you want to know what is this sudden change in my table, and you would go walk up to it and you would hold the phone and you would want to explore and know about it, right? So Pavlov orientation reflex, or the Pavlov reflex, is also very important. And if these pathways are dysfunctional in children with autism, and if these reflexes are not integrated, they are not communicating, then it can affect their level of curiosity. The child will have difficulty to explore. Nothing would seem to excite them. Their arousal would be low. They would not want to explore. Their exploratory capabilities will go down, which will again impact their learning. Because curiosity is the mechanism that sets in the motion for exploration and learning in our day to day life. So a lot of traits, and one of the most important trait not to forget is the repetitive traits in autism. Now we know these primitive reflexes are repetitive in nature. They are predefined, they are automatic, and every time you stimulate, they are going to respond in the same way. They are going to respond exactly in the same way. And if these primitive reflexes are retained in a large, you know, uh, large volume, most of the behavioral traits of the child will also be very repetitive in nature. And as we all know, every movement is associated with some emotion. Now, every sensory experience you have, if your fear paralysis or if your Moro's reflex are always retained, it will cause an undue stress, activating your HPA stress axis, and the child will always be in a state of stress, and this will again impact their neocortex, or the frontal part of the brain, which is a logical brain, to think. It will dampen their thinking capabilities as well. And because of constant stress, children may have bowel and bladder dysfunctional issues. They might have sleep issues. Some might have difficulty to cope up with the change in routine. They would be very fixated to the routine. Any change in their environment, they will have difficulty to adapt, and any change in the environment would trigger that undue stress mechanism. So, if we try to pin down a lot of traits in autism, most of the traits or all the traits would be linked to some form of primitive reflex. And that is the reason that these primitive reflexes, if they are retained, not only in children with autism spectrum disorder, but also in children with any form of neurodevelopmental disability or delay, they need to be integrated so that this, the, the higher brain can gain dominance, or they are able to, you know, work in a proper way. We do not want our lower centers to take decisions for ourselves, because it does not involve any thought. It's an automatic process. There is no learning into it, and it actually dampens your cortical brain from functioning efficiently, and rather puts your brain in a state of chronic stress. So that is the reason evaluation of these primitive reflexes with your clinical observations, trying to correlate with what primitive reflexes needs to be integrated, and working on the integration of these primitive reflexes along with your ongoing therapies, it will just accelerate the progress in your child in terms of achieving the milestones. And that is the reason the role of assessment and integration of these primitive reflexes becomes significant, not only in children with autism spectrum disorders, but also in children with other neurodevelopmental disabilities. Now, I will keep the time for 5 to 10 minutes open if there are any questions. I would, since I do not have an access to the Facebook and I don't know who all are live, I would just keep it open for a few minutes. If there are any questions that come to me, it would be shared in the Zoom. So I will wait. And even for people who are going to watch this video later on, you can always put down your questions in the comment section, and we would revert back to you. Okay, the question by Dhana Kandula is which reflexes the child must have at the age of 9 or later on 9? So see, all the primitive reflexes should get matured and integrated by age of 3. So there should not be any retained reflex after age of 3. So that answers your question. And if a child has any retained reflex after age of 3, it is going to affect them in some or the other way, as I have mentioned in the examples. If it is a fear paralysis reflex, the child will be constantly under a state of anxiety. If it is a Babinski reflex, it might just impact their gait, their foot alignment. If it is a TLR reflex which is retained, they might have a lot of vestibular insecurity. If it is a grasp reflex that is affected, it might impact their learning, finer and gross motor skills, abstract thinking, ability to understand. So any reflex that is retained should be integrated. So see, our survival reflex, the fear paralysis reflex and Moro's reflex are there with us because they are present to protect us, but usually they emerge only at life threatening situations. So usually the Moro's reflex or fear paralysis reflex is something that come up, but again, as I said, they are meant for our protection. So these reflex will always come back, not hinder your cortical brain, but they will come back to protect you. Just an example, there is something called as hand supporting reflex. So if you are about to fall, automatically your hands would extend to prevent the fall. So these reflexes still are there, but they will not hinder your cortical brain. They will come back just to protect you. So every reflex has its own role that way. So when I say these reflexes are integrated, does not mean the reflex fade out. They just do not bother your cortical brain from functioning. Okay? I hope that answers your question. And these reflexes will continue to protect your, you know, your body from any form of trauma. It will always protect you. Okay, Dhana, no more questions from your side. Okay. Now, I guess whatever questions are there, I have answered. If there are more questions, you can put it in the comment section and I will revert back to you. Thank you so much.